who may be required. Again, this is care which is affirming. It is not pushing them to change. It is not done till the person has a matured body. So please remember this. We need parent support groups to come in and talk to parents. Again, the role of the parent support group is not to get them to change, but to prevent child abuse, to prevent the child from getting into dysphoria. Dysphoria is a mental health illness. It has got a coding by the DSM-5-TR, not an illness, right? And gender dysphoria is not innate to the individual, but gender dysphoria starts mounting insidiously, as Dr. KP told us, and it starts multiplying because the narrative is not believed. And this is something, as medical care providers, we need to step up and start educating parents.
Thank you, sir. Thank you, sir.
Please introduce yourself.
I am Air Commodore Dr. Sanjay Sharma, retired. I am the CEO and Managing Director of Association for Transgender Health in India. I am also the co-chair for the International Diversification Committee of World Professional Association for Transgender Health. I am also a member of the WHO Guideline Development Group for development of guidelines for transgender and gender diverse adults.
Okay.
And I also am a member of SWICAR, which is a parent support group called SWICAR the Rainbow Parents. So
Okay.
that's about me.
Today you are in the city of Lucknow. Right, please let us know the occasion.
So I have come here on an invitation from an NGO called Sati,
Okay.
who are doing very nice work in educating people about transgender and gender diverse people. I'm partnering with them for educating doctors, paramedics, and general public as such regarding issues faced by transgender and gender diverse people. We have a structured course also which we are doing. So today we have done a workshop which is held in this institute of KGMC.
KGMC, yeah.
And so today we had an opportunity to talk to mental health providers. There was an invitation from the Department of Mental Health. And we also have talked to students and social workers. And we also have community members who are part of Sati who have come for this workshop. So this is a 2-day event.
Okay.
So today is the pre-conference event, and today we started around 9:30, and we covered the basics of gender-affirming care. Then we went on to talk about the mental health issues and what is the role of the mental health provider, and following which we had a panel discussion where we had people who shared their lived experience. And this is very important because when people who have had the experience, when they talk to medicos, they are giving first-hand information, because this is not written in textbooks. There is no structured course that is taught in medical colleges. So we have to learn from them as to what their requirements are, and then design the care so that it is tailored to their needs. So this was a very important panel discussion which happened, and this was done by people from Sati, including community members. Then I had a talk, and we talked about how to create a gender-friendly healthcare facility. There is another name which we use, which is called queer-friendly healthcare facility. Now, this topic that we are covering is covering the marginalized section which is popularly known as LGBTQAI plus community. So, traditionally these people have been denied care because these are not subjects which we learn about in medical colleges. Also, these are not topics which are discussed in families. So, this is a new subject. It is the subject is called transgender health, and it covers the the care modalities for this group, and specifically for transgender and gender diverse people. So we are, like I told you, I am also apart from the Association for Transgender Health in India, I have a professional organization which is called Indian Professional Association for Transgender Health. So we have about more than 110 members, which consists of plastic surgeons, endocrinologists, mental health providers, social workers, people from the community, and who work in this field of transgender health. A large number of them are working in the private sector and with NGOs. But we also have, a sizable number who are working in government hospitals.
Okay.
So, that's what makes this group very dynamic, because we are, due to our education, the privilege of having been educated, and also connecting with international faculty which has the domain knowledge, we are able to get this information down to our country. We have also designed written the first Indian standards of care.
Okay.
And we brought these out in 2020. We also have worked with the Ministry of Health and Ministry of Social Justice. Ati was instrumental in getting the Center of Excellence working in All India Institute of Medical Sciences, and we have been working with them. We are conducting trainings with them, and these trainings are conducted both in a hybrid mode. We use a online telementoring platform, so which works on a hub and spoke method. So you have experts who join us internationally, and we have faculty from IPATH, our own, so that we can get the flavor of both. What is happening in the West, how we can tailor that to the Indian conditions. And we have designed courses. There is another very unique thing we have done is that for the first time in the world, we started training healthcare managers. Because if there is a facility, like you have in hospital, but the healthcare manager is not aware of the needs of the professionals who are going to work for transgender.
True.
Right? He doesn't know the supply chains, he doesn't know what kind of OTs they require, what kind of reception they need, what kind of outreach work is required. So we built an online course to come in, and we talked to the International Institute of Healthcare Management in Dwarka, New Delhi. So we had 6 faculty members from that side and 6 faculty members international, and we did a 10-month online course where we trained about 40 odd people in transgender healthcare management. So this is the first time that we are getting this vertical also in. Our idea was that whatever science is there, and this is a very evidence-based subject. So we want that there should be a uniform care model, for which we need the Indian standards of care. In fact, the 2019 Transgender Persons Protection of Rights Act had given directions to the Health Ministry that you must make a health manual on the lines of the World Professional Association for Transgender Health. So we have got those latest standards, and we are now working on the Indian Standards of Care version 2. Like I told you, in 2020 we have got version 1. So now we are in the process of getting the version 2. God willing, by July end we should have it. We have already finished the groundwork. It is being reviewed because all these scientific documents need to be peer reviewed. So we are sending it out to both our international friends and to the community members. And that's a very important step that we want to do. Because till the community does not vet these protocols, we will never know whether we have been able to deliver what they want.
Okay.
Otherwise, it is a one-way street, Like I said, this is a new subject. And like I said that, I am not a transgender person. I have studied transgender health. But that real life experience, that is with the transgender person. So we have written based on what is the current evidence, and we have put it in English. We will, once this gets reviewed, both by professionals as well as the community, then we will translate this into Indian languages, right? In fact, talking about translations, we have also translated the World Professional Guidelines, the SOC 8, which is called, which came out in 2022, into Hindi and Urdu.
Okay.
And now work is going on to get the next translation in Punjabi and Bengali.
My God.
We will then, once we have this, and you know how difficult translating anything into a regional language is. So as we are able to get some funds and we get somebody from the southern states, then we will translate it into Tamil,
Telugu,
Malayalam, and Kannada.
Yeah.
So these three languages we also want to get so that we have a wide reach. Interestingly, we were doing a lot of good work with the Center of Excellence at New Delhi. But this 13th March, we took a setback because suddenly an amendment to the Transgender Persons Protection of Rights Act was announced. Now, this actually had a devastating effect on the community members because this amendment was talking about removal of self-affirmation of gender. Nobody can make out whether you are transgender or not. Because this experience is in your brain. Physically, I cannot check you and say, okay, or do an MRI, or do a blood test, or take your DNA and tell you. I can't diagnose gender incongruence. And this is there is evidence to this effect which has been gathered by WHO, and like I told you, we have already written the guidelines for trans care, and they have categorically said that gender incongruence, which is the word they are using for the umbrella term transgender as is mentioned in the Act, and I'm talking about the 2019 TG Act. So gender incongruence is based on self affirmation. That means I will tell you whether I am comfortable inside in my brain, my perception, does it match with what you are telling me is my sex or not? Like if it is, there's a mismatch, then I have a condition called gender incongruence. This is not a disease. There is no treatment or cure for this.
Okay.
What I need to do is, now just as we have diverse forms in the animal kingdom, in the plant kingdom, we now know that human beings are also diverse, right? A very simple example is that the two of us are standing face to face, and the color of my skin doesn't match yours. The size of my nose doesn't match yours, right? There is a diversity in human form. And similarly, there is diversity in human perception. So, when we say that remove this self-affirmation, right, then we de-recognize gender identities, and we erase gender identities like trans men, like self-affirmed trans women, like non-binary identities. And this amendment is saying that no, we will only recognize certain groups who are traditionally known to be transgender, and these are groups, the 4 groups that have been named are Hijra, Kinnar, Jogtas and Aravanis.
Oh.
Right? So what the government is saying that only these 4 people are transgender.
Okay.
And these are all trans feminine people.
Oh.
So we don't have any trans masculine representation. It is also, there is an error that has happened. Bureaucrats and whosoever has advised the person who's authored this amendment is that they are mixing transgender with intersex variations. Intersex variations are variations due to differences in sex development. So, this I can diagnose by either examining you or doing a sonology or a CT scan to see your internal organs, or do a DNA test, see your hormone levels. So these people are commonly called as intersex people, right? So what the government is saying, that first category we will recognize is Hijra, Kinnar, Jogtas and Aravanis. Second category we will recognize are people who have intersex variations. And they will call them transgender instead of calling them intersex, right? Which is against what the world is doing. The third category they are saying is people who have been forced to undergo some mutilating surgery or some hormonal intervention by antisocial people with an idea of making them beg or perform the activities that the traditional transgender people do. So even these people they will recognize. But what they have done is they have attached one clause, and this clause is called 18, and this clause has punishments and prosecution which is linked. So what this clause says that if anybody forces somebody to assume a transgender identity, then they would be punished by imprisonment up to 10 years of imprisonment and fine of more than 5 lakhs per year. And if they do this to children, then the punishment is even more severe. So what this did was that it created an atmosphere of fear. And now, after reading this clause, and you can Google this clause, it is available online, the healthcare providers, they got scared. Because now they could be prosecuted.
Sure.
Tomorrow, if I operate on a transgender person, the government is saying that you tell the district magistrate who you have operated on.
Oh my God.
That means, as a doctor, your confidential information I will now give to district magistrate. So just imagine this information going to a bureaucrat's office, and how many people will
get to know
go
about
through
that. Yeah, true,
right?
yeah.
And this is confidential information which the Minister of Social Justice is instructing doctors to go against their medical ethics. Because our ethics say that between the doctor
and the patient,
and the care seeker, we don't call them patients because
care
they are
seekers,
not,
true. Got your point.
They are care seekers. But if you have come to me as a my healthcare facility, I can't divulge this information unless there are 2 conditions in which I will do that after I have told you.
Okay.
Right? With your permission. Because whatever you are sharing, you are the owner of that information.
True.
I am only custodian. So if this information is hiding a crime or leading to a crime, then I can share this information with the designated authority. Or if this information is likely to harm other human beings. So the intention is that if there is an infectious disease, let's say like COVID, there was a reporting that was there. If there is tuberculosis, HIV, all these infections which can cause a public health issue, there the Ministry of Health will direct me with a written order to share this information. It will put out a protocol, right? There have to be forms that I will fill up. I need to get this person his informed consent, with his permission. He may say, no, I will not give this. Then I'll record it like that. I say, okay, this fits into the medical ethics where I can share this information. The government is asking me to break my code of conduct. So see, what this has done is that the healthcare providers are now afraid to give care. The government has decided that who is transgender. Then they are firing from the shoulders of the doctors to say that you set up a medical board and you diagnose transgender.
Oh,
This I can't do.
exactly.
Because even WHO says that gender incongruence.
There are no parameters also.
WHO also says that. But he's saying you diagnose. Then he's going a step further. He's saying apart from these transgender people, don't give care to others. If you are giving care, you report. Right? Then it is going a step further. It is saying now you will the proceedings of your board will be given to the district magistrate, who will then decide whether you will get benefit of the government schemes. The government schemes that are being talked about is Smile Yojana. Now what Smile Yojana does is that it gives you Garima Grace, right? It gives you job opportunities. It also has a medical insurance which is linked to Ayushman Bharat. So under that you get 5 lakh medical cover for this gender affirmative care. Do you know how costly this gender affirmative care is?
Please tell us.
Just take a guess.
Please tell us, sir.
25 lakhs
My goodness.
is an average cost for getting your mental health, endocrine care and surgical interventions done. Right? Nobody can afford this kind of money, right? Unless I am from very rich
Luxurious family, yeah.
or I am so desperate that I am ready to sell myself, do illegal activities, gather money and then give this to untrained people who will operate on me, right? Now the government is saying that these benefits which were coming and the government has done a lot of work. All India Institute of Medical Sciences, we have people who have been given care. Now suddenly that care is stopped.
Okay.
The private practitioners now are charging more money for the same care because now they want the lawyer to give an affidavit. They want the person to stand in front of the magistrate and on oath say that I agree for this care. So this is the kind of fear that has come in. This is damaging the mental health and also physical health of more than 2 crore citizens of India. Because gender incongruence, the prevalence by the WPATH has been penned to be about 1.6 to 2.7%. Right? This is not figures that I am giving you. These are international figures which the World Professional Association has stated. That means out of 100 people, you will have at least one person who would identify as transgender. Are you ready to allow these citizens of our country to suffer? Again, and you will appreciate this, that when I talk about one transgender individual, this individual is sitting in a family. The family size in India is 5. So just multiply this by 5. Because the family also gets prosecuted. And I can share this with you because I myself am a parent of a trans person. I have faced these issues. I was lucky to be serving in the defense services. And defense services are known to be very progressive. They gave me all care. But see, my mental condition was such that even though they were supporting me, I could not continue working. I was, going through a career where I was bound to rise. I took premature retirement at the rank of Air Commodore.
Oh my God.
I would have gone one more rank further.
True, yeah.
Right? But see, this is the angst. My second child is facing issues. My wife faces issues. Today, when we stand outside and we speak among people, then it is my bearing and my privilege that I stand and I talk to you. I don't care if somebody likes it or doesn't like it, but that is me. Just imagine, can a middle class person who's got maybe another daughter to marry, whose firstborn son is now saying that they are transgender, that means in our Hindu traditions he's losing face in his community. Would they be able to stand? Would they be able to give care? And without government support, will we be able to educate the teachers? Because these children face bullying in schools, right? The percentage of dropouts is maximum among people who are transgender. They barely are educated. They do not pass the 10th class. Those of them who do pass have different names on the school-going certificates, different names that they have adopted. So they can't be given jobs. They cannot be given higher education. Now the government decides to take away whatever it had already given. There was a portal that was created, and we would very well appreciate this, to create an online portal by the government of India, which is pan-India. You imagine the amount of human resource that have gone in, the amount of financial spending that government would have done, because to create a simple app, I go through a process of so many iterations. They have set up one platform where you could change your identities without interaction with human beings, right? You could get this identity changed in your voter ID card, Aadhaar card, your birth certificate, your educational certificates, all on the basis of a 15 rupee non-judicial stamp paper which is notarized.
Sir, as we have a long experience of
yes,
right?
Yes.
So I just wish to ask you that do you see a positive change in the perception of the society towards the transgender?
See, that is what I'm saying. That we were going uphill, right? Internationally, India was seen to be the leader.
Okay.
I have represented my country in international forums. When I speak in WPAC, I represent India. And we were talking about having a law which was pan-India. We were giving care through the public health system, not private care. We were giving medical insurance. We had self-affirmation as a criteria for change of gender markers. You know, these are the 3 criteria which decide whether a country is gender friendly or not. And from position of leaders, we are now placed below Pakistan. Just imagine.
Okay.
Today, I have to put my mooch down. My head bows down. Because today I can't stand in the international forum and say that we are the leaders of diversity. Today I have to say that my politicians do not understand their own citizens.
Oh my God.
Today I have to say that with a very heavy heart, that you have not seen the angst of parents who have transgender people, right? You have ignored that. And this is not about religion. This is not about caste. This is not about economics. This is about human beings. Because being transgender, it does not happen because you are a Hindu or a Sanatani or a Muslim or a Christian. You are diverse because nature is diverse. I have one child in my family who's gender diverse. Tomorrow it could be your family. And just imagine what that mother will go through, because there is no care that her child is going to get, because you have undone the medical care that was to be given. And medical care is a right which was given to me by the Constitution. Right to life is something which is embedded in my Constitution. We are not people who are troublemakers or who want to be anti-establishment. But this is what we have been painted to be, right? We have no agenda. We are talking about health. And this is the kind of damage that you are doing. Do you know that the Minister of Social Justice was asked this question in Rajya Sabha, that he was told that, due to this amendment coming out, people have stopped giving care. He said, no, the care is on. Right? He said that in the Rajya Sabha. And but he did not share that information with the Health Ministry. There has been no direction from the Health Ministry that please carry on giving care. You just imagine if I am a government doctor and we have the amendment which is passed in both houses rapidly. There is a show of strength, the political will to get out an amendment which nobody is able to bring down. Sense is not prevailing. Will I put my neck out and give care? Would you put your neck out and give care? I would say, I will follow what the government is saying. But this is affecting more than 2 crores, like I said. If there is a small earthquake that happens, we have, the whole government response. There was this incident which happened in Indore where there was a sanitation mix-up with the water line and people landed up in hospital. A public health emergency was declared. We had the minister who was sitting in people's homes, directing the civil engineers, directing the healthcare providers. And how many numbers did you report over there?
Very less.
Maybe 1,000. How many numbers am I telling you?
Crores.
Crores.
Yeah.
There is just like that event, and that's a public health emergency which demanded a whole government response. This event where mental health of people went so bad that there are instances where community members have done self-harm. People have stopped giving care. So their hormones, their surgeries have all come to a standing halt. Will a 18-year-old or a 20-year-old wait for a year or 2 years to do what a young person should do?
True, sir.
Right?
So, sir, we wish you all the best for all the efforts that you're putting in, and we really appreciate, and we believe that others will get inspired from such a personality like you.
It is a human appeal that I want to make to you. We need to understand that we are dealing with human beings. We need to understand that this is not a disease that we are looking at. We need to understand that this is got no political mileage, right? This is a very vibrant and a dynamic set of people. If you give them care, these are the people who design your software. These are the people who do your fashion. These are the people who do your entertainment, right? These are mathematicians. These are scientists. Right? Don't look at them as people you see on the traffic light who you yourself have thrown out. Right? Wake up. It is never too late to own up to your mistakes. We are not gods. And definitely the government is not God. If you have been misled and we are calling out to you, please listen to us. Correct it. You will get blessings of thousands of mothers, thousands of fathers who stand with their children, who have taken that courage to stand with their children.
We believe that your efforts will bring out more positive outcomes.
It must.
And we wish you all the best for your future endeavors also.
Thank you so much.
Thanks a lot for being with us.
Thank you so much.
And we
God
wish
bless you.
a good day ahead to you.
Video on. अच्छा.
Okay, done.